section of the bed or stretcher. The waist belt is snugly attached and aligned so that the grommet holes fall across the patient's navel or valley of the waist. Since patients are all differently proportioned, there must be sufficient bed attachment. The straps must be very tightly secured and the waist centered in the bed. For centering patients, check that the inner restraint grommets are equidistant from the sides. The yellow side straps must be attached to ensure that the patient is centered in the bed. These will arrive already installed. This typical bed provides examples of possible attachment points that are in proximity to the center of the bed where the waist straps may be attached. Notice that these points move with the top of the bed as the bed is raised or lowered. This attachment does present problems if the bed is lowered, resulting in slack belts, always a potential hazard in restraints. If this point is used, the bed should be at its lowest position. This other attachment point will be used for our demonstration. The yellow side straps should always be tightened into the buckles of the waist belt that allow a patient to roll only a certain distance. But it will only prevent direct rollovers to the side of the bed. With some effort, Pinel's side straps are removable, but will arrive already secured into the buckles. The V-buckling method is self-tightening that prevents accidental removal. Determine the desired distance of permitted roll and attach to the same pins that hold the waist to the bed. These lateral straps may also be used either to position a patient on his side or prevent a patient from rolling over on an injured side. A unique but very important Pinel item, the pelvic strap, is intended to stop the upward movement of the waist belt over the thorax where possible asphyxiation could occur. You are strongly encouraged to apply this item to any patient with potential for an egress attempt from the waist belt. It does not stop removal of the waist belt when it is pushed downward, but can be used in conjunction with the shoulder belt to prevent this from happening. The loop is passed upward between the bed and the belt. Pass your hand under the interlocking straps and grasp the loop, pulling it through the straps. Now, pass the main body of the pelvic strap through the loop and tighten. The strap is then passed through the patient's legs and attached by 2 buttons to the waist belt. Here, the normal waist belt is attached to a patient using 2 locking pins and buttons. Notice that we're folding the belt over twice to give a firmer hold in the patient's waist. Recheck for a snug fit after a few minutes of movement inside the belt or when the bed is raised and readjusted. Pinel never suggests having a loose belt, such as allowing passage of a hand between the belt and the patient. Loose belts never stay in that position, and it's during travel that they become hazardous. Notice that the patient is able to make full rolls and that the lateral straps are preventing a further rollover. Here, the pelvic strap is attached to a patient's waist belt using the 2 buttons. We recommend leaving a 1-inch space between the crotch and the strap to allow for rotation and preventing irritation in this sensitive area. Potential problems with rotating waist belts. To alert you to the potential danger of the rotating waist belt, we illustrate some short and certainly not complete scenes of possible accidents. The main problems are associated with improper application of the waist belt to an unstable but very persistent patient who attempts bed or chair egress. It is always a good exercise to visualize yourself in the intended restrained position and try to anticipate all of the possible problems. In addition, you must ensure that your staff is fully aware of all of the Pinel requirements and limitations. This bed checklist should help in the learning process, and we encourage novice staff to use it during their introduction. In the following scenarios, all the recommendations suggested by authorities are followed. Belt loose enough for a hand to pass, lateral straps attached, and bed rails up and blocked. In this case, the patient attempts a frequent strategy of a downward escape, forcing up the waist belt over the thorax. Egress target is gap at the foot of the bed. When she cannot, she rotates within the belt and throws her legs over the railing into a fatal position. Helicoptering is an unreasonable rotation in bed in a circular motion by a confused patient. During the rotation and the rails up, the interlocking straps that hold the top of the waist belt with the bottom become entangled with the lateral straps and tighten with each rotation. If the belt is located above the thorax, this continued movement will asphyxiate the patient. The lateral straps could be tightened to prevent rotation, or limb straps could be attached. However, both methods would make her immensely uncomfortable. She would need to stay face up without being able to roll from side to side, making the rotating waist belt useless. By far, the most dangerous egress is through the gap in a split rail because it is in the patient's line of sight. Lateral straps only guard against direct rollovers, and with any twisting direction, the lateral straps become ineffective. Do not restrain in this type of bed, but if you need to, use the Pinel gap cover. Any other entrapment space, such as end-of-bed gaps, should also be blocked. Pinel encourages the use of the simple pelvic strap to prevent the previous problems. It is based on the simplest of concepts, the baby high chair. It stops any movement downwards or prevents the waist belt from moving upward into the danger zone. It also stops possible helicoptering. Of course, it alone does not stop all possible accidents. For example, should you make a mistake by leaving off a gap cover, this clip shows that the pelvic strap is still a highly protective item. Please note that this setup is prohibited. It is necessary for you to assess the patient and his restraint environment and use your wildest imagination to determine how he or she could possibly get into difficulty. Then, use whatever Pinel equipment you have to prevent that potential problem. But here is your dilemma. You are also trying to keep the patient as comfortable as possible and minimize restraint use. Although not always shown in this video to reduce visual clutter, here's why bed rails must always be in the up position or a gap cover installed in split rail beds. The gap in split rails is a tempting escape route, and lateral straps will not prevent an accident. Here, the Pinel gap cover is quickly installed by looping two aggressive Velcro locks over the top railing. The double foam inserts, the inside one soft, the other hard, also prevent the collapse of the gap cover when legs are thrown on top. However, an alert patient may want to remove the Velcro, leaving the gap open. In this case, we wrap 3 straps securely around the rail and bed frame and lock them together using the Pinel lock, preventing patient removal. The shoulder strap is still used to prevent the waist belt from being pushed downward and off the patient. Of course, with bed rails in the up position, an escape from the waist belt inside the bed means that a patient must negotiate this barrier. Begin by laying the green trimmed belt behind the patient with the X in the small of the back and the green pockets facing upward. Pass the long straps through the black loops. These are intended to eventually pass under the armpits. Now lay the other straps that were pointing towards the head of the bed over the patient's shoulders. Bring these straps down and connect them onto one or two of the pins that hold the waist belt together. Take the patient's right remaining strap and pass it through the pockets of the shoulder strap as close to the armpit as possible. Take the remaining strap and pass it over an inserted pin on the patient's left side. The other right strap now joins this strap on top of the pin. Ensure snug connections. Patient should feel snug and secure, not uncomfortable. She should be able to roll in all directions and sit up without strain. If necessary, to prevent the movement of the waist belt either up or down, use both the pelvic and shoulder belts. Both are connected to the waist belt with two pins that were inserted for the pelvic strap. Partial limb restraining. The limb belt is also useful with an aggressive dementia patient to prevent strikes or scratching, tube pulling, or self-damaging injuries. The cuff is placed on the patient and secured to prevent the cuff from being pulled off. Pass the long end through the waist buckle and attach it to the same pin that holds the waist belt onto the bed. The amount of arm movement can be delicately controlled to suit the situation. In this case, the patient is able to use her hands and fingers to make herself comfortable. Unlike gloves, she has the ability to manipulate her hands and fingers for self-feeding or grooming. Yet by controlling the distance of arm travel, she is unable to remove an IV or cause other self-injury. In addition, she is able to turn in bed in all directions for a proper rest. Chair use of waist belt. Always check for chair stability since tipping of chairs by aggressive patients has occurred. The bed waist belt is very adaptable for chair use while allowing many options of balanced comfort and security. It may be kept on the patient when moved from a bed or can be attached in advance, as shown here. The long attachment straps pass to the back of the chair and connect tightly in the back with a lock. If there is a possibility that the patient is able to work the waist belt up and over the back of the chair, loop one of the attachment straps around a solid chair member to prevent upward movement. Secure the belt around the waist snugly. This is a very comfortable seating arrangement and permits a lot of movement within the chair, thereby providing long-term comfort. For additional security, the side straps are inserted. And pulled behind the chair and locked. Now you have less movement, but more patient stability within the chair. This is appropriate for patients lacking upper body control. If further upper body control is required, use other Pinel items such as the torso or shoulder belt. The ultimate in chair safety is to prevent downward sliding. The side strap is buckled to one of the attachment straps at the back of the chair and joined straps are passed under the chair, between the patient's legs, tightly pulled, and attached to the pin holding the waist flaps together. The yellow strap prevents the patient from sliding off the end of the chair. Ensure that a dexterous patient is not able to work a leg between the side strap and the waist. In this case, use a pelvic strap. Now, let's recap the
that Mr. Jones is Mr. Jones, and he is. The next thing that I am going to show is how to put on the wrist restraint. You always want to make sure that these are hanging towards you. And then you're going to put on the restraint. Feed it through both of the chains and then down through, so it looks like that. So I'm going to make sure that I have 2 fingers, and that I'm also going to give the resident a little bit of room so that they can move. You don't want them so tight to the bed that they can't move. And then you want to make sure that it is to the bed frame. So I like to put this down first and then this up behind. So I have this in front and this one hanging down. Then I tie a loop, wrap it back behind, put my fingers up through, and grab it, and tie a quick release knot. So you want the patient to be able to have a little bit of movement, but not so much that he can reach down and untie it. So after you have tied it to the bed, you want to make sure to secure it underneath the bed so they can't reach down and untie it. And then another thing, after the 2 hours is over, or if an emergency occurs, this is a quick release knot so that you could get them out of it very easily. The 2 hours is over, so we're going to release Mr. Jones for at least 10 minutes to go to the bathroom, eat, and do some range of motion exercises. We're going to cover him back up. I will put his bed to the lowest position.